My name is Lynn Grossman. I'm a marriage, family, and child counselor, and I'd like to welcome you to Windows on Wellness. This is Judy Morton-Fraser, who's also a marriage, family, and child therapist. And we developed this program to bring people from different healing professions to talk about the healing process and about growth. And I'd like to start today by asking, reading you a question that we got from a viewer, and it's a very interesting one, and I'd like some feedback from you. One of our viewers wrote in and wants to know if someone comes to therapy and they're in an abusive relationship, would you advise them leaving the relationship?
Oh, that's a difficult one. It depends on how dangerous it is. I would have to evaluate what they mean by abuse, whether they're being physically abused, if their life is being threatened. I'd want to educate them on abuse. I don't think it's that easy to leave. So if someone were willing to discuss it, number one, that's a big step, because what happens often in abuse is that the physical abuse occurs, and then after that, the other spouse is very loving and very sorry for what happened.
So it's easy to get caught back into staying.
It's seductive. It's
Very
seductive.
Yeah.
And then things seem to go okay, and then very, very smoothly, and then it's like a volcano. You know, the pressure starts building and building and building until it erupts again, and someone's hurt again.
Right.
And the issues in that have to do with recognizing the different energies in the person. So when I say a volcano building, it's that they stuff their feelings down. So learning how to communicate, how to listen to feelings, you know, and share them with another person in relationship is very important.
Yes.
I also find that people come into therapy blaming the other person for abuse when they feel that they're the victim. And it may be verbal abuse, or it may be that the other person just doesn't know how to ask for what they want and to set limits and to trust their own feelings. So they are continually setting up being a victim. You know? We all are so different, and we assume the other person knows exactly where we're coming from.
Instead of checking it out.
Yeah, instead of checking it out. I have a friend who tells a story that it's if you're Chinese and only speak Chinese, who are you going to reach out for? You know, not an Italian.
Right.
So if you're familiar with the pressure that you're feeling in your relationship, you will attract a relationship with the same amount of pressure. So I feel that going back and looking at your childhood.
Without blaming.
Looking at your relationship with your parents and your parents' relationship with each other, as well as other very important people in your life, you know, works without blaming.
Without blaming in a harsh way yourself, because sometimes I think...
Without blaming yourself?
Yes.
Oh, yes.
That's what I mean, because sometimes people really get stuck in this place of...
just blaming themselves.
Just blaming themselves, and and getting stuck there instead of the piece of taking responsibility.
Yeah. No, I do workshops that I call Healing the Inner Child, because I think when we learn to listen to our feelings as an inner child, and to be tender towards that child, tender towards ourselves.
Right.
You know, things keep happening to us for a reason.
Right.
And they come up over and over again to be healed. So that's part of what you and I do.
Right.
You know.
Right.
And part of what our guest does in a different way is to help people to listen to themselves, to separate out, and to take responsibility.
Right. Thank you very much. And I'd like to encourage viewers to either write in or to call and ask any questions that you'd like to regarding therapy or some of the things that you hear in any of our programs. We really welcome feedback. And now the best part and is introducing our guest today, who is Dr. Susan Hudson-Langa, who is a doctor of Oriental Medicine. Hi.
Hi. Hi, Susan.
We're really glad to have you here today.
Yeah.
Very, very glad. And she, a doctor of Oriental Medicine, I'm going to give the mic over to you about explaining exactly what you do.
Well, you were saying, Judy, that you wanted to know why I got into it. And It's a long story, but it's in my family. My grandparents went out to the Orient in the 1920s, and my grandmother started doing yoga, and then my aunt started teaching it. I'm like the third generation yoga student. And then my aunt started acupuncture in the early 70s in Australia. And my husband is an acupuncturist, and his father is a Western medical doctor who's totally given up Western medicine to study, to practice acupuncture. And when I was teaching in England, I taught my cousin acupuncture. So there's rather a lot of it.
It's a family affair here.
It sure is.
Yeah. Yes. And I originally wanted to do Western medicine. And when I was about 17, 18, my eyesight went terrible. I couldn't see. I got blinding headaches.
That must have been frightening.
It was, because I thought, what am I going to do with my life? Here I am. I can't do what I want to do.
Right.
So I went and studied languages. I got a degree in Russian. I got a scholarship to the Soviet Union, and I ended up working for the Foreign Office. And that way it was like I learnt to use my ears. I learnt to listen. And it was the first time I really got a concept of what it means to be in a totally different country that we're supposed to be afraid of, and that the people over there are as dedicated to world peace as we think we are over here, and that they have the same yearnings and loves and desires and fears. And in the meantime, I hitchhiked, or I went overland to India from England, and I got very ill. And I spent a year in and out of hospitals. I nearly died, and I kept taking Western drugs. And
What did you have? What was wrong?
I had amoebic dysentery, which affected the liver. I had severe liver damage. And I kept being given painkillers, and nothing helped. And I just got worse and worse. And all the side effects, I was always sleeping. Couldn't do anything. And somebody finally said, why don't you try acupuncture? And I hadn't thought of it because I so believed in Western medicine. And the first treatment changed my life. It's like I felt here were finally people that could help me heal, and that I didn't have to be a vegetable anymore.
Must have seemed like a miracle at that point.
It was. I mean, it took a long time to actually get better, but instead of just going downwards, I started going up.
You started feeling like you were making some headway.
Yes. I also had severe depression, because with the liver damage, in Chinese terms, the liver is connected with depression and repressed emotions. And what was so peculiar to me at the time, my eyes started getting better, because liver and eyes are connected. So I mean, it was a dramatic example to me of how the whole body works together, the emotions, the physical, the spiritual.
So you could feel it first. You became a believer by really feeling it, experiencing it.
By experiencing. And so I knew that that's really what I'd wanted to do, and maybe my eyes was a lesson to me to keep me off the drugs and make me go into a more natural healing method, or there's something that resonated inside. So I started my studies with a Chinese doctor in Hong Kong, which is where we lived, and she was called Dr. Frances Wong, and she is pretty amazing. In fact, she's working in America now, somewhere in Washington. I think she travels a lot. She was a friend of my mother's, and she uses herbology, she uses facial diagnosis, and even handwriting.
What do you mean by herbology and facial diagnosis?
She uses Chinese herbs, and she will do the diagnosis the traditional way, asking questions, and it's like a jigsaw puzzle. You ask lots of different questions, and then it's like a pattern. And then you understand not just, okay, someone coming in with a stomach problem, don't just treat the stomach. There may be 10 different reasons for it. Some may be intensely emotional, for example. Others may be just simple physical, eating too much hot, spicy food. So then I went back to college, got another degree in acupuncture at a college in England with a man called Dr. Van Buren. And his teaching was fairly unusual in that it included something called stems and branches, or celestial stems and terrestrial branches. It sounds very romantic.
This is so funny, because I used to joke about some detox programs where you had bark and roots, remember?
Oh, really?
I really was obviously plugging into something.
Oh, well, you were. Yes. And that works very much not with what they call the normal Chinese acupuncture, which is taught in China now, but it's an older form that was really thrown out because as China became more westernized, they wanted very empirical training, something that was easy to pass on. And this takes quite a long time to work, and in fact it's all encapsulated. I don't know if you can see this chart. Can it focus on that? Which
Hold
I'll
it
go
up
back
long
to.
enough so that they can come in and possibly get a picture of it.
And I'll go back to it later. But that was what started me on realizing that we could work on deeper issues than just stomachache. Why did the person get the stomachache? What was really going on from way back, contributing to finally the physical symptoms manifesting.
And what do you do about it, though, when you do go back and discover reasons?
You start working on those old issues.
In what way?
I'll come back to that later, remind me, okay?
Okay.
Because my special interest, in fact, is what you brought up, was when I was like early teens, I used to have this recurring dream of this very bright blue sky, probably the color of my dress, like just glowing, and there'd be this black line, just very clear black line all the way across the picture. And then suddenly it would just get all wound up and tangled and really tight, and then I'd wake up and it was like I'd be very sad after it. And I kept having it, and then one day at at our house, my mother used to have a lot of healers passing through who would be coming in from India or out of China or whatever, and they'd always come to our house. There'd always be meetings. And this one Swami was talking about how we come into our lives with a blueprint. We come from this area of like pure love, and we come in and we're so excited with what we want to do. And somewhere between conception and being born and after,
there's
things
already
get twisted.
Yes.
And we lose that sense or that connection with that loving, and everything gets tangled. And as he was talking, it just hit me, and I just rushed out of the room, and I just cried and cried. It was just, it was like, it was just the sadness of why we do it. And inside, after that, it was like I was always searching for how can we get back to that clarity and that beauty and that joy that we've lost connection with. So that's why this chart or this work that I started to be taught made so much sense. And then later on, I came across a form of footwork or foot massage called metamorphic reflexology. And that, by working on the feet, works on the same thing of getting you back to that period in the womb, or even before, where we made the decisions that took us off our path. And so when people feel that yearning or that anxiety that they're off their path, is where I feel, I want to bring people back.
Yes.
And when I was 18, I went to Hiroshima and saw all the results of the devastation there because of the bomb. And it really brought that dream back, as this is what happens when that pure clear line gets totally tangled up and we allow it to. And so
you bring up something else that reminds me of a question I've been asked many times, in what I do, and that is that how can you do what you do knowing the devastation that's going on in the world, the pain that we inflict on animals, and on other people, on each other, and by your talking and sharing, it reminds me of the only thing that I understand, and that is you can only do what you can do. And so through your awareness of wanting to go back to innocence, back to purity, back to a healthy body as well as mind, the work that you do with other people really does make a difference, not just to that person, but then to the other people that they touch on.
There's an interrelatedness.
Yes.
Exactly.
Yes.
So just by working in our own areas or our own fields, we can just start creating a circle or a ripple. And this work that I do, it tends to get people, it can often trigger a spark off so that their awareness opens, and then they will find the right therapist or the right herbs or the right book or the right, the right person to help them just open up more and let go of that fear.
Why would people come to you? For what problems do they come in?
I'm getting a variety now. This stems and branches, as it was called in England, has now evolved since I've been out in America or in California. My Californian patients are calling it karmic. Not comic, people think, but karmic. Acupuncture. And so some come when they're physically healthy, but they come to just start getting deeper inside, start unlocking.
Okay, so people are coming to you because they want to look deeper inside. That's wonderful, you know. That's wonderful that people are open to that.
It is, it's fun.
And I was thinking that no matter what they come to you for, you know, whether it's back pain or stress in some area of their body, or physical disabilities, which is why you started, that it seems like the reasons are all very individual.
Yes, absolutely. Yeah. And that's also interesting. It's like the time we're born, there are energies in the universe, and they influence how we choose to be born. We bring in those energies. And so different people, and this chart, in fact, reflects the secrets of the universe in a way. So the different people come in and they all approach a similar problem in a different way. So somebody who might have had abuse, you know, in their childhood, one type, for example, like the Shui Yin type, which is more a liver type, we would say, would be much more introverted about it. It would damage them much more than somebody who has different energies, more earth energies, for example, and then it would maybe just float off them. In a similar way, you'd get people who come in who really want to go deep down inside and search why have they got that problem, and go really heal their soul. Other people will come in and they don't want that. You can't even begin to work with them on that. All they want is their elbow healed or their stomach healed.
Okay, so you have to deal with what they want and give them what they come in for.
Well, it's also it's also what they're ready for. I mean, it's very similar to therapy, where people will come in with specific things that they want to work on, and or come in because their lives are not working in the way that they would like them to work, which is a growth process.
Yes.
Yeah, I think people need to test the waters too.
Yes.
You can never guess if they're coming in just for one specific problem and only want that solved, you know, whether they may come back in a month or 6 months or whatever. But people need to test out relationships in there and how they can feel safe, you know, with themselves and with the other person that they're working with. I want to know, though, if someone came into you who wanted to stop smoking, what would you do?
Absolutely depends on the person.
Okay.
If they just want to stop smoking and that's it, I usually send them to my husband. He's very good at that. If I suppose I would be more willing to work with the people who maybe want to decide, yes, I want to stop smoking and I want to do something about it, rather than people who come in and say, okay, I want to stop smoking and you do it for me.
I was just going to say that's what it sounded like. It's like working with someone who says, do it for me, to me, rather than being a participant with you in the healing process.
So somebody who really wants to take responsibility, and I can just be a catalyst for them, so that to trigger the right things that then they will know deep inside. It's like what you were talking about earlier, and getting in touch and with your own inner guidance.
Okay, and with feelings that are being pushed down and hidden because of the smoke screen that's being put up, or so there's something individual even you're saying about smoking.
Absolutely.
Oh, yes.
Yes.
Okay.
Yes. And it may be purely a chemical addiction, in which case we will help that. If there's something more, like, as you say, what is it hiding? Or even sometimes the smoking can warm this heart area, or the pericardium area we talk about in Chinese medicine. And if they're missing that warmth of the love, if they've never let that in, then maybe that's why they need to smoke. So if we can get them back in touch with allowing the love to come in, or letting the love come out that's hidden deep inside, then that can be really rewarding, because then it opens up their whole life, not just in their smoking, but in all other areas.
Oh, that's interesting.
This is why we decided to call our clinic Meridian Medical Center, because it was working not just with the meridians of the body, but the meridians of the planet. So when people see us, it's not just give them a needle or give them some Chinese herbs and send them home. It's how do they relate at home? How are they in their environment? It also brings up the issue of pesticides and pollution, teaching people maybe to avoid, you know, toxic cleaning products, things like that. It's like it's our whole life that we want to deal with, really. And then in doing that, maybe we can help the planet.
Oh, you do, I'm sure. I'm sure that when you affect one person, you know, it's affecting the planet.
Yeah.
So going back to where you began, it's not just that it's the physical, it's the emotional, it's the spiritual, it's the environmental. I mean, inward environmental and outside environmental. Yeah.
And the Chinese, there's this book which was written 2,000 years ago, which is so wise, and it talks about how we are affected, man is affected by the universe, by the elements, which is the energies that I work with when I'm doing the Karmic acupuncture. And they say if the elements are out of balance, then man becomes out of balance. And we are creating a planet that's out of balance, and it's making us more out of balance. So if we, I feel the key is us, if we can get ourselves more in balance and more harmonious and more loving, and just like open up back to that original blueprint, then we could heal our planet, we could heal our universe. I really believe we can.
Oh, I do too.
Yeah.
And the way you're talking, it's as if you work with people rather than fix them. You work with them.
Yeah, I like that.
And I try to think of what I do with others as doing that too, and I think that Lynn does too. We have people too who come in and want to be fixed, you know, want to be told what to do or whatever, and it doesn't work that way. It is a process of discovering more about the person, helping them to discover more about them and the balances in their life.
And I think it's very tempting sometimes as a healer or in the healing professions to have your own agenda for someone.
Very.
Rather than, you know, because you can see the potential, you can feel, you can see the potential of what could be, you know, but to really be sensitive to the person's agenda.
And there's a reason. There's a reason why they hide or why they can't do whatever it is they're having a hard time with.
It's not to be obstinate.
And it goes back to what you said about smoking. I'm just fascinated by that image. Really clarified more of what you do for me, and that is that smoking, people may need to warm up their heart area. Goes in the lungs, which is right near the heart, the bronchi. So possibly they're expanding that area. They are trying to expand that area, but of course are causing damage to their physical bodies while they do it. But it's the only way that they knew how.
So then it's up to us to allow them to substitute, or have the courage to substitute, something that's going to help them and make them feel good.
Do you work with children at all?
Yes. Yes. I used to work a lot with children in England, and they're terribly responsive. I even I used to work with this little 1-year-old, and normally we don't use needles on them, we just massage them. In fact, you know, with people who hate needles, we never need to use needles at all. And
that's a good thing to say, because there may be people out there listening who are going, oh, I don't want all those needles in my body.
So they use acupressure then?
Yes, you can use acupressure or herbs or homeopathy. Homeopathy is very effective. But even if you need to use a needle or two, because needles is just so much more powerful, they don't bear grudges, children. It's like you can put a needle in, and with this little 1-year-old, I remember, she would just look at me with these big blue eyes. She'd burst into tears with the first needle. Then she'd forget, and then the next needle would go in, and she'd look.
Why did she come to you?
She had the DPT, a vaccination, diphtheria, pertussis, and tetanus. And the day after that, she's got chronic diarrhea. What became chronic, it never stopped. And her mother had been able to work with her with homeopathy whenever she got a cough or a cold. And after the vaccination, it just caused her immune system, or this is what her mother thought, to just go down a notch. And so she came to just clear that out. And then we have children that come in with skin rashes or teething problems, colic.
Is it easier to treat a child than an adult?
They're very, very receptive. And it's like people used to accuse me, you know, of, I don't know if it's an accusation, but they used to say that it's all psychological. You know, you get a lot of very Western thinking people
Right.
say it's not scientific, so it's not working. But if it works with children and animals,
Even though it's
then-
been used for thousands of years.
been used for that. Yes.
Yeah.
And it may be psychological, you know.
well, where do you,
but
where do you
What
animals.
isn't? But
Yes.
but at least we can, if there's something that can be affected to bring about a change, you know, that's what we're going to try.
Right.
Exactly.
Right.
So, and I don't mind, in fact, if it is purely psychological, but with children, they don't believe it's going to work. Nobody's told them. Or with animals, they don't.
Right.
You know, you can't tell an animal, okay, this
They'll
pressure
have a
point here
response.
is going
Right.
to solve
Right.
your arthritis.
You know, there's so many more things that I wanted to ask, but I don't think we're going to have time. And I really want to thank you for being here with us today.
It's been a pleasure.
Thank
It's
you.
been fun.
Isn't it over with quickly?
Yes.
meridianholistichealth.com